Hi, everyone, and welcome to the 2025 FNC Concussion and Brain Recovery Summit. I am Dr. Mischel, and in this session, we are going to talk about neurovisual integration in post-concussion syndrome. So, why does vision matter after a concussion? Well, over 70% of the brain is involved in processing vision. So, a lot of our patients come in reporting things like blurred vision or double vision, trouble reading or focusing on near tasks or near objects, headaches and eye strain with screens, especially with all of the tech that we are using today with computers, TVs, phones, iPads, you name it. Headaches are going to be a big piece of that, as well as dizziness in complex environments. So, things like grocery stores and large crowds. And then motion sensitivity and fatigue are another huge piece of that as well. So, with this, all of these kind of visual issues that people are experiencing commonly aren't only an eye problem. Often they reflect dysfunction in neurovisual integration, which is the brain's ability to coordinate visual, vestibular, proprioceptive, and cognitive networks. There are four major pieces of neurovisual integration. The first is going to be oculomotor control. So, this is going to be things like saccades, which are quick eye movements, moving from one target to the next as you look around in your environment. The next is going to be pursuits, which is the ability of the eyes to smoothly track objects as they go by. Fixation is going to be the ability of your eyes to stay steady on an object. And vergence is basically the ability of your eyes to move in and out as things come close and far away. Okay? Next thing is going to be cerebellar modulation. So, this is going to be basically coordinating and fine tuning different eye movements. The vestibulo-ocular reflex, or VOR, which is the ability of the eyes to stay steady while your head is moving in multiple different directions. Cortical processing is going to be the last piece of that too. And this is going to involve multiple different areas of the brain. And so this is going to be basically doing things like mapping and initiating eye movements along with recognizing visual stimuli. And if you have a concussion, a lot of times this is going to lead to disruption of one or more of these networks, which causes these hallmark visual dysfunctions that we see. Here at the FNC, we have multiple different diagnostic tools that we use. And the first one is going to be the VNG. This is basically going to let us see your eyes in the dark and in the light so that we can see what's going on from multiple different perspectives. So, in the dark, we're able to see nystagmus patterns. And then once we bring you back into the light, we take a little piece off and you're able to see again. This is going to basically allow us to track your pursuits, saccades, and optokinetic responses as well. Our ReadyTrack device allows us to measure really, really subtle eye movements to 1.1 degrees of motion. So this allows us to be very specific with our testing. We also look into things like dynamic visual acuity and VOR testing to see if the eyes are able to stay steady as your head is moving and as you're walking around in your environment. Or if you're doing quick movements like things in sports where you have to quickly turn your head to find things, we got to be able to keep our eyes steady while we do that. Convergence and near point testing is basically testing the ability of the eyes to work together as objects come close to us and far away. And optokinetic flow testing is going to help kind of determine things that might be leading to visual motion sensitivity. Cervical proprioception and postural testing is also a big piece of this as well, as neck integration is a really big piece too that plays into visual disturbances as well. Maddox rod testing is one thing that we like to use because it's very sensitive for uncovering binocular vision dysfunction. And so with that, it's going to look like this. We've got kind of this, let's see if we can get that on there. We've got a little tool here that has some vertical lines that are going across. And then what you'll do is you'll shine a light through it. And basically that'll give you a horizontal line. So you go from looking at it vertically, it'll give you a horizontal line. and you'll be able to see a light and a line. The goal is for that light and the line to be perfectly in line with each other. If it's not, that can show us things like subtle phorias or tropias, which is basically eye misalignments, that can lead to a lot of these things like eye strain, headaches, difficulty with tasks up close, fatigue when reading, and disorientation in busy environments. So, commonly, we see this with patients, and a lot of times it's just one of those things that goes missed during a standard exam. And so, first of all, just taking a look at this is going to be very helpful because if your eyes aren't going to be perfectly aligned, you're going to have a lot of problems tracking objects. If we've got one eye that's a little bit higher than the other, or if we're a little bit turned out or a little bit turned in, that's going to lead to a lot of problems processing basically visual information. We have a couple of different rehabilitation strategies here at the FNC. One of them is going to be oculomotor and binocular training. So things like saccades, vertically, horizontally, and complex. Pursuit training with metronome pacing, so on a beat, basically. Vergence drills to recalibrate near-far focus. So that's going to be doing things like this. Brock string therapy is also going to kind of help train that vergence system as well. And then we also are going to use things like Maddox rod rehab. So trying to get the eyes to be perfectly aligned again so that you can go and do all the things that you want to be doing, like reading or playing sports or just being able to look at your phone without headaches. Visual and vestibular integration. So basically doing rehab strategies to help with VOR adaptation and basically help rehabilitate that response and that reflex that should be there and should be crisp. A lot of times we'll see that VOR response gets delayed or becomes kind of sluggish. So doing things to rehabilitate that is going to be very helpful for things like motion sensitivity. Another piece of that motion sensitivity is going to be that optokinetic. And so, are your eyes able to pick up the environment as you move around? The next thing that we kind of look at too is digital vision therapy. So, using things like IBAB. This is an online program that allows us to work on all of these different kind of visual pieces of the puzzle. So, that IBAB is going to allow us to work on saccades, pursuits, vergence, fixation, all of these different things, as well as kind of incorporating memory and all these other different kind of aspects that we like to tie together. And then we also have a case study here. So we had a 32-year-old teacher come into us here with blurred vision, dizziness in busy environments, and severe fatigue when she was reading. Some of her findings were that her convergence near point was at 14 centimeters away. And then, so that would be considered a convergence insufficiency because we want the eyes to be able to turn in together to focus on things that are up close. And if you can't, that's when you have trouble with your reading and your phone and all those sorts of things. She also had abnormal saccadic accuracy, so things like overshooting or undershooting targets as you try to look at things. So, say I wanted to look at a tree or look at something on my desk, being able to look straight to it is going to be very beneficial versus having to overshoot and then come back and find it, or undershoot and make a second eye movement to get to that target that you're basically trying to look at. Again, that Maddox rod, she had a subtle esophoria, which is basically going to be that the eyes are turned in a little bit. So thinking something like being cross-eyed a little bit, that type of a thing. And this was something that was missed by a lot of different providers before she came in to see us. And then the last thing too, her VOR gain, so her vestibulo-ocular reflex, is basically, again, when we are able to turn that head but keep your eyes fixed on a target without letting them move off the target. And so basically, as we took her head and just kind of turned her to the right side, her eyes would come off of that target and they'd end up following, and then have to refixate back. And so that's another big piece too that is going to lead to a lot of dizziness as well. So some of the things that we did with her is going to be Brock string training, which is basically a string of beads that you can place at multiple different distances. And this allows us to train that vergence system. Optokinetic priming and saccade rehab, so more of those kind of oculomotor rehab strategies. We used IBAB so that she can kind of take that home as well and then be able to use that at home to continue training that and to continue her rehab going forward. And then VOR training with postural tasks and the Maddox rod, of course, to just kind of reassess and see where we're at with getting those eyes to be straight ahead versus being turned in. We did an intensive with her, and by the end of her intensive, her near point of convergence improved to 6 centimeters. So she was able to follow that target in further before, like, say she was out here before, now we're in here. So now her eyes are actually able to converge and diverge properly how they should. Another thing that she was super excited about was that she was able to read for 30 minutes without headaches, which previously she had trouble reading for 2 minutes. So this was a huge improvement that she was really pumped about. And then the last thing too was that her dizziness in visually complex environments was totally diminished. She was able to go back to grocery stores. She was able to go in large crowds and be at events and concerts and all sorts of things. So why does this matter? Patients with post-concussion syndrome are often told that your eyes are fine because standard eye exams aren't going to catch these very subtle issues. A lot of times, what happens is we're just going to look at, okay, can your eyes track this target? Okay, yeah, they moved up. Yes, they moved down. Yeah, they were able to move to the side. They were able to move to the side. But how well are they actually doing that? Are they moving smoothly or are they broken down? Are they super choppy? Are we actually following the target? Or are we just starting here and somehow ending here? We see that commonly here. Using the Maddox rod was another big piece, especially in this case, but we use this with every case that we see because this is going to basically help allow us to retrain your eyes to focus and to be properly aligned so that as you're moving around in your environment, you're not going to have trouble and get all these headaches and all this dizziness. And so here at the FNC, we don't like to treat one problem at a time because often people's problems are going to be very multifactorial. So we like to use kind of this whole neurovisual integration piece, which basically gives our patients the ability to read, move, and live again without constant fatigue, constant dizziness, and all these issues that they are commonly struggling with. Alrighty, thank you for attending this session of the FNC Concussion and Brain Recovery Summit, and we will see you next time.